Good afternoon, everyone. My topic is quantification of tear trough deformities using ultrasonography and efficacy of hyaluronic acid fillers for tear trough correction. So, tear trough is a common aesthetic concern characterized by sunkenness and shallowing under the eyes. It is applied to the medial periorbital hollow extending obliquely from the medial canthus to the mid-pupillary line. Two distinct layers contribute to the tear trough, that is subcutaneous plane and the deep plane. And superficially, the tear trough correlates with the junction between the preseptal and the orbital part of the orbicularis oculi muscle, along with the skin texture and the underlying fat as the contributing factor. In the deep plane, there is tear trough ligament medially and the orbital malar ligament laterally that leads to separation between the tear trough and the lid cheek junction. So, aim of this study was to explore the use of ultrasonography for accurate measurement and classification of tear trough deformities based on a thickness. So, and the secondary objective was to see the efficacy of correcting these tear trough using hyaluronic acid fillers and to report potential complications, if any. So it was a prospective observational study including 20 patients over a period of 1 year, and ultrasound was used to measure the tear trough and as well as assess the exact location of the vessels. Following the measurement, the patients underwent correction using HA fillers in the pre-periosteal plane with a 25 gauge cannula, and follow-up was done regularly. A global aesthetic improvement score was used to assess the cosmetic satisfaction of the patient. So the patients with tear trough deformity who wanted shorter recovery downtime, unwilling for surgical procedure, and who have not undergone any cosmetic or surgical procedure in the past in the periocular area were included in the study. Rest others were excluded. So the age distribution of my study population was from 29 to 65 years of age, and majority of them were females. So pre-filler ultrasound and HA fillers were done on both the lower eyelids of 20 patients, that is 40 eyes. And the ultrasound revealed the tear trough thickness ranging from 2 millimeter to 6 millimeter. So this is a ultrasonic image showing the orbicularis oculi muscle, the vessels, and the intraorbital fat and the periosteum. To achieve some level of quantitation of the results, a graduated scale was devised and used to grade the tear trough deformity and was classified from grade 0 to grade 3, grade 0 being less than 2.5 mm and grade 3 more than 5 mm. So based on that grading, we got the mean values in our group 3 groups, and this was the mean filler injected in the tear trough area. This is the different grades of the tear trough deformity and the mean amount of filler that was required to correct these deformities. And as you can see, it was in proportion to the grade of the tear trough. So this is the ultrasonic image showing the various grades of the tear trough. And as we can see, as the grade increases, the thickness of the tear trough has also increased. So this is a patient with grade 1 tear trough, and as you can see, post the dermal fillers, the tear trough appears to be concealed. This is a patient with grade 2 tear trough, and we can see the concealing of the tear trough and the correction. This is another patient with grade 3 tear trough deformity, and for the sake of time, I'll skip the video. And these are the results post the HA filler injection in the tear trough. So global aesthetic improvement score was measured for every patient for the aesthetic satisfaction of the patient, and a line graph was plotted at each follow-up for each patient. Only 20% of the subjects needed re-injection within the 1 year of follow-up period with no serious complications, and only minor complications were seen in 5% of the patients. So our study reinforces the role of ultrasonography as a precise and reliable tool in alignment with the recent researches. Additionally, we utilize ultrasonography not only to quantify the tear trough, but also to assess the amount of HA fillers that are needed for its correction. And our studies revealed a direct proportionality between the grade and the amount of HA fillers used. And also, HA fillers effectively restore the volume with high patient satisfaction and minimal adverse effects in the periosteal plane, and blunt tip cannula was the preferred choice. Advantages are that it is a non-invasive radiation-free method with detection of the angular veins and the infraorbital vessels, avoiding the vascular complications during the filler injections. So these were my limitations. To conclude, ultrasound is a reliable method for quantifying the tear trough allowing precise assessment and avoiding complications and treatment planning. And HA fillers are efficacious in improving the aesthetic outcomes with high patient satisfaction and minimal effect. Thank you.
Dr. Vatika, this is a nice initiative you've taken up. Like ultrasound is routinely used in some Western countries.
Yes, sir.
But I didn't hear anybody else using ultrasound before filler in India.
Thank you, sir.
But tell me something, what filler were you using, and did you use the same filler in all the patients?
Yes, sir. We were using a 15 milligram per ml concentration HA fillers.
No, what was the name of the filler?
Sir, Voluma.
You're using Voluma for tear trough?
Yes.
Okay. But using Voluma for, it is usually not prescribed for tear trough because like it can lead to serious swelling. Like it absorbs a lot of water. Usually you don't use Voluma for tear
Sorry,
trough.
Volbella, sir.
Volbella. Okay.
Yes, sir.
Okay.
So you were doing simultaneously ultrasonography and filler injection, or it was pre-operatively the ultrasound? And you
Whenever an aesthetic patient used to come, then we used to do, we have kept that high frequency ultrasound, not high frequency, 10 hertz ultrasound machine in our aesthetic clinic only. We used to do it. But I have shown in my limitation also that we have not done ultrasound guided filler. We just marked, saw the what is the grade of the tear trough and where are the vessels exactly, so that we can avoid that injection in the vessels.
And you have said that like you used to use 0.3 for 0.3, 0.5. You are giving these values. So were you exactly using the same values? Because you know,
Sir,
you can't
no,
generalize like this.
No, actually,
different patients may require different amount of fillers.
No, sir, that is the mean. I have written plus minus the
Okay.
standard deviations. That is the mean.
Okay.
Have you noted any complication?
Sir, because we are doing ultrasound, we are doing pre-operatively the ultrasound. So only in one patient, that is 5% of the patients, we noted some minor bruising and swelling, which subsided subsequently in our follow-ups. No major complication was noted.
So all the patients had an aesthetic reason for getting it done, or any functional reason also?
No functional reason,
No,
ma'am.
they
really.
had
All
no
our
issues. All
aesthetic
were of
cases.
aesthetic reason.
And you also talked about GAIS.
Yes.
You didn't tell anything about that in your slide.
Yes, sir. I told it. Yes.
Sorry, I missed it.
It is a global aesthetic improvement score that every patient, we ask the patient how much he is satisfied by the results. And we calculate it on, so this I have shown. We calculate at each visit, and then we plot a line graph, the mean Gaia score of all the patients, and plot it for each follow-up. So after 1 year, we noted that around 78%, 74% were still satisfied. So only 25% needed a re-injection. And out of those 25 also, not everyone underwent injections.
So this was a subjective assessment. So only a subjective assessment, or objectively you?
Objectively, ma'am, photographic analysis we do that I have shown the results. No
Yeah,
other
in
objective score
ultrasound,
is
are
possible.
you doing a post?
No,
filler
I'm
ultrasound?
not. We have done, but I'm not included in this study because
No, that
it was
is-
not for all the. I couldn't do for all the patients, so I have not included in that.
So do you
that
think
is
that
a
is
ongoing
important
study,
because your
yes.
base is mainly ultrasound? So
Yes,
would that have added value to your
yes,
presentation?
yes, ma'am. It is an ongoing study. I will add.
Yeah.
Thank you.
And you were doing the ultrasound yourself, or the radiologist was doing it?
No, sir. We don't have a radiologist. We
Doing
do it
yourself.
ourselves.
Thank you.
Thank you.